Welcome to Hot Topics. My name is Russ Knopp, and I am the owner of Comfort Keepers. At Comfort Keepers, we strive hard every day to help seniors stay independent and live in their homes as long as possible. At Comfort Keepers, we're proud again this year to partner with the Petoskey Regional Chamber of Commerce to bring you Hot Topics. We think this series is important to bring issues that are important to business owners in a timely manner. I hope you enjoy today's presentation. Thank you very much.
Welcome to another Petoskey Strong Focus on Health Hot Topics. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined by Dr. Karen DenBesten, the Infectious Disease Specialist at McLaren Northern Michigan. Great to see you again, Dr. DenBesten. Thank you for joining us.
Yeah, thank you, Nikki. Thanks for inviting me.
We want to talk today. Here we are in the new year. Vaccine rollout has begun. We want to talk a little bit about the vaccines. So, starting off, how does the vaccine work? Is it safe and effective? Those are like the two things that I think come out most right off the bat.
Yeah, these vaccines are very exciting. It's kind of a new technology, the way that they work. They're what we call messenger RNA vaccines. So what this is the messenger RNA is from the virus. It's a little piece of genetic information that codes for the spike proteins on the virus. If you see that picture of the coronavirus, it has those little spikes that come out. Those are the spike proteins, and those are critical for entry into a human's body when they're infected with coronavirus. So those little spike proteins attach to ACE receptors in the body. So those are a really tempting target for a vaccination. So what the messenger RNA does, it sends a message to the cells to make these spike proteins so we can develop an antibody response against those spike proteins. So it's just like sending a little blueprint to the cell. This is what you need to make. This is what you need to make your antibodies against. It's very, very, it's genius. It's really great vaccines. I will point out that this messenger RNA does not enter into the nucleus of the cell. It enters into the cell and uses the cell machinery to make some spikes, so there's a target for the antibodies, but it in no way gets into the nucleus of the cell. It's just disintegrated, the minute it gives that message to the cell. The cellular enzymes break it down. Messenger RNA is used in the body to make all kinds of proteins that manage our day-to-day activities in our body. So this is nothing, that the body is not doing on a daily basis anyways.
And considering
there
that
are no additives, there are no preservatives. It's very simple. It's that messenger RNA. And then I will point out that messenger RNA, it's very fragile and delicate. That's why these vaccines have to be stored at extremely low temperatures. So in order to protect that messenger RNA, they have to kind of put a little kind of envelope or bubble around it with this lipid envelope around it. So that's all the vaccine contains is the message and then a lipid kind of envelope or bubble around it. And this all gets broken down very quickly after the cells receive the message, what they need to do.
And and you just pointed out too, there's not all these things or additives in it. It's simply the messenger RNA, the important part of the vaccine that obviously is what is going to help us to build that resistance and antibodies to COVID. So the effectiveness of it, the safety of it, you hear people saying, well, is it because it happened so fast? I don't think the public obviously has, full scientific knowledge of how long it could take and does take typically for vaccines or drugs or whatever is made to help us fight off things. And so this came so quickly. I think there's some people that are like, well, I don't want to take it. It happened too fast.
Right. It definitely was very impressive how quickly this vaccine was made available. There was a huge investment on the front end, billions of dollars put in to making these vaccines up front. The money was put in to develop the vaccines and start making them even before we knew if it was going to work. That's the difference here and why they were able to come into development so quickly. There was a huge investment on the front end. No phases were skipped. It went through all of the safety trials and the efficacy trials and the different phases that vaccines go through. And, it was given to tens of thousands of patients and it was proven to be effective, like 95% effective. So very exciting when we heard that information, that all this work and all this front end investment really paid off in the end when we saw the results. So no phases were skipped in the making of these vaccinations, and they're shown to be effective and shown to be very safe as well, good safety data associated with them. Really the only side effects that really have been seen with the vaccine are those that are with the immune response that you're having. So there are side effects that we want to see, that we expect to see, because you're mounting an immune response. Post vaccination, some people have had allergic reactions that have been managed safely with antihistamines or epinephrine, but that's very rare, but we have seen some cases of that. So really minimal side effects, good efficacy, good safety. And yes, they came to the market quickly, but in a good way.
And typically too, from what my understanding is, people that have had, very few people that have had allergic reactions are typically the people who have allergic reactions to other types, flu vaccines, things like that. So they're almost, I don't want to say predisposed, but it's part of their makeup, and it's not, there isn't this severe side effect that's coming from this. And so the safety is there very much so. Before we talk about who should have it, is it okay for, people with allergies or pregnant women or anything? One question I know we're getting tremendously already from businesses is, when does my staff get vaccinated? And we're going to be speaking with the health department this week as well about that. But I know that McLaren, you get the same question, is when do I get the vaccine? So a little bit about the phases from the Michigan Department of Health and Human Services too.
Yeah, the vaccine is being rolled out in phases, as I'm sure you know. Phase 1A is the frontline healthcare workers who are taking care of COVID patients. And that's where we are right now. Healthcare workers are getting immunized. Here at the hospital, we've been able to vaccinate over 1,000 people and roll it out to community healthcare providers too. We're immunizing, the dentists, the private physicians in the community, so healthcare workers. And then phase 1B would be next, and I'm hoping that will come soon. We don't have a definitive timeline on that, but that would be the frontline workers, the police, fire, teachers. These would be the ones that would be elevated there. And then after that would be, I would assume, would be the business owners. So they will be in the first 1BC kind of phase. And then the second phase will be just the general public. But also in phase 1A, in addition to the healthcare workers, it's nursing home patients. We do know that nursing home patients are at very high risk for dying if they contract COVID. So we're trying to get the immunization to people who are extremely high risk, or to people who are taking care of COVID patients. And then in phase 1B, it will be those frontline workers, as well as elderly people with underlying illnesses. And then 1C will be more of kind of like anybody with an underlying illness. And then after that, the general population. So I don't have a definitive timeline for you, but I know we're getting tons of calls about when can I get a vaccine. I think the rollout will be a collaboration with the hospital, Department of Public Health, the pharmacies, local physicians' offices. As vaccine becomes available, there will be more information on that on the Department of Public Health website. They have good information about when to expect vaccine.
And so the big thing is be patient right now, and know that your hospital and your health department are working in conjunction and following directives, obviously, from the Michigan Department of Health and Human Services too. So, and that's the good thing.
Yeah, the Michigan Department of Health and Human Services is managing the rollout of this. And just understand, we at the hospital and the Department of Public Health are completely committed to, as soon as we get vaccine, to get it in people's arms as soon as possible. That's the goal.
Yes, absolutely. And so let's talk about that. Let's talk about, we talk a little bit about, side effects, efficacy, the process, how it works, when it rolls out. What about, is there people that shouldn't get the vaccine? Pregnant women, if you're planning to get pregnant, if you have allergies to eggs or otherwise, is there anybody who shouldn't get the vaccine?
I think there are very few people who shouldn't get the vaccine. Knowing what I know about the vaccine, I don't see how it could be problematic in specific populations. For example, some vaccines are live attenuated vaccines and you can't give them to certain populations who are immunosuppressed. This vaccine does not at all work like that. It's a messenger RNA vaccine. So there are no populations who can't get the vaccine. That being said, there are populations that it has not been studied in. It was not studied in pregnant women and it was not studied in children. So it cannot be, given in those populations just because we don't have the data, not because we're aware of any potential problems or issues giving it in that population. I think as more vaccine is available and more data is available, we'll probably have more information about its use in pregnant women and in children, because those are certainly populations that would need to be vaccinated.
Right.
But right now, we just don't have the data to be able to say it can be given in those populations.
And that's under 16 for children, correct?
For children, it's under 16. So
Yeah.
if you're 16 or older, you can get the immunization, but you would probably be put into that group number
Right.
2,
Yeah.
for
Right.
in the lineup. As far as egg allergies, these are not grown up in eggs. They're messenger RNA vaccines. They just contain that little bit of blueprint material and lipids. There is no egg in it. Egg allergies, that's not an issue.
Good. Good to know. So let's talk about how long does the immunity last when you get the vaccine? Do you have to get it every year? Is it like the flu shot where you want to get the flu shot every year? That's what you do.
Mm-hmm. I think that it's, we don't exactly know how long the vaccine will be effective for, and that data will come out in the clinical trials as these patients' antibodies response is followed for, the months and years to come. I think it's safe to assume that you're going to have robust immunity for a period of time, probably months to hopefully years. We'll see if boosters are going to be necessary, if the immune response wanes over the years. But I think it's safe to assume that we're going to have immunity for a good period of time, hopefully long enough to get an end to the pandemic and get COVID out of the community is the goal.
And speaking of having it in the community, if you've had COVID, do you get the vaccine?
The short answer is yes. But if you've had COVID, we know that you're probably going to have some immunity. How long, we don't know, probably for at least a few months. So if you have had COVID and you know you've had COVID, you could wait until maybe a little bit more vaccine is available and get your vaccine and let people who have no immunity go first. But I would recommend just everybody getting the COVID vaccine.
That makes complete sense too. I especially appreciate that. And I think people, I know people who've had it and have already said that. They're like, I can wait as long as I need. I know that I probably could get it again, but I would rather somebody else get the vaccine that needs it, that doesn't have any immunity where I do. So what about I've heard people say now, well, how long, when I get the vaccine, how long till it takes effect? How long till I'm great?
Right. So as you know, the Pfizer vaccine, you get your initial dose and then you get a booster 3 weeks later. For the Moderna vaccine, you get your initial vaccine and then you get the booster 4 weeks later. You're probably going to see immune response within 10 days, but to get the full effect, it's not going to be till after you get that second booster. So anywhere from 10 days to 4 weeks for the Pfizer vaccine. But you're going to start seeing some good protection even before you get that second booster. But you need to get both of the vaccines to have the full immune response.
And that's the key too, is don't skip that booster. That's extremely important for the overall too. And when we talk about beating the pandemic, getting the vaccine and following up with the booster, that's all part of it. It has to all kind of play out.
Right. The first dose kind of primes the immune system. And then the second dose, you're going to get a very robust antibody response. So you need both of them to get the full antibody response.
So when we look at it, what percentage, when we keep hearing herd immunity, and there was obviously talk before about just get herd immunity. Well, how does the percentage of the population that needs to be vaccinated to get herd immunity, I think some people are saying, well, that's just going to be in a few months, but that's not how that works.
Yeah, this concept of herd immunity, that's how many people how much of the population, what percentage of the population needs to be vaccinated or immune to the virus to protect the whole population. And we don't know exactly what the herd immunity will be for COVID. That's why you can't get a straight answer from anybody. We do know for highly contagious illnesses like measles, you need like herd immunity of upwards of 95%. Now, COVID isn't as contagious as measles, so is 70% good enough? Do you need 80%? I think that the kind of like number that people are thinking you need at this point is probably upwards of 70 to 80%. So the more people that could get immunized, the better. The higher the number we can get, the better chance we are going to have of getting rid of COVID transmission. So I think if we got 80%, I would be very happy with that, and that could probably be the magic number that we would need to prevent further transmission of COVID in the community. But the more the better. Everybody should just get vaccinated.
The more the better, and patience and time. It's going to take time for us to get everybody vaccinated. It's going to take time for everybody to get their boosters and do all those things. And in that time, and I think this is one of the, from a community standpoint, from a business standpoint, one thing we hear as well, okay, so once people have the vaccine, can everybody stop wearing masks? Well, like I got my vaccine today. I didn't, but can I, take off my mask now once I hit my 4 weeks?
Eventually, but not yet. The goal will be to have enough people immunized that there's not going to be spread in the community, and that we can eventually get back to normal and take off the mask. But we can't do that yet for a number of reasons. One, there's so much community spread of COVID still that everybody needs to wear the mask. We do know that this vaccine provides excellent protection against contracting COVID, but what we don't know is if you still could get just a little mild COVID illness if you've been immunized and still have the potential to transmit virus. There's that possibility. So we don't want to have this false sense of security. I've been immunized when you could potentially be shedding the virus. That's not a reason not to get immunized. By getting immunized, you're going to decrease that chance of transmitting virus, although we can't be sure it's going to go down to zero and we'll still need to wear the mask. But also by getting immunized, we're going to prevent, hopefully, transmission of COVID and keep that virus from mutating and spreading resistant virus even further. So it's really important to get immunized to prevent the spread, but it doesn't necessarily guarantee that you're going to not spread COVID. So we still got to wear those masks until COVID is out of the community.
Right. And that means social distancing. We go right back again, stay safe to stay open is what we did all last year, all summer long. And, now that means something a little different. Now it means staying safe to continue for us to get back to normal and open up more and stay that way is getting the vaccine, but getting the vaccine as a community, and also continuing to wear those masks and social distancing, and understanding that we still have things that restriction wise that are going to be in place, and, gatherings and things like that, where we have to be patient and continue to do what we have done so that we can get to that, 1A, 1B, 1C level of vaccination throughout the community.
Right. The vaccine is another tool to get to where we need to be. The mask, the social distancing, the vaccine, these are all ways that we're going to get healthy again as a country, as a nation, as a world, and get back to normal.
And so speaking of normalness, which we know there's no such thing, how is the hospital? What is status, staffing, services? I know when we talked in November, it was kind of scary. A lot of, obviously we were in a huge spike, but it was also, after 9 months of doing what you've done at the hospital, what healthcare frontline workers have done, the exhaustion level is there, obviously. So just checking in on staff and everyone in services, how is the hospital right now?
November was a very, very difficult month. It was scary. There was a lot of COVID. We had a lot of patients in the respiratory isolation unit. probably around Thanksgiving was of the peak of where we were at with hospitalized patients. Since this time, the numbers have decreased. Our respiratory isolation unit is running anywhere from 8 to 10 patients now. We're up to holding steady at 30 for the whole entire month of November and into December. Unfortunately, we had some patients that did well and they were discharged, but unfortunately we've had some deaths as well, and that's very hard on everybody when that happens. We still do have patients coming in with COVID, but it seems like that huge spike has decreased. Just really proud of the community and happy that everybody came together and heeded our advice and maybe didn't kind of have the big gatherings at Christmas and at Thanksgiving that we feared would spread COVID. And also there were, executive orders to, wear the masks and follow the guidelines, and the high schools and the colleges were all online. And I think all of that helped. Nobody likes these lockdowns, but they really do work, and they got the numbers down. They worked back in March, and they worked now, at least in our community, to get the numbers down. They're hard on everybody, I realize that, but they really do work. There still is COVID, but our numbers are coming down. Our percent positivity rate in Emmett County is coming down. So we have less healthcare workers that are out sick, and we do have good availability in the hospital. And I think that people are starting to see a little bit of light at the end of the tunnel, even though COVID is not gone. We do have immunization available now, and manageable numbers in the hospital.
And that's a good place to be. And as you said, none of what we've done at all has ever been easy this entire time. The balance between the two has been so hard. And, we talk every day about how absolutely difficult it is for our businesses to be shuttered or hampered or restricted, and our schools and our community. But it did work, and it worked, like you said, in March, and it's working again. And now we just need to stay vigilant and keep up on it. And, once again, Northern Michigan, we definitely have, a little bit of difference than the rest of the state. And that's where, again, we look to saying, okay, remember, we're here and we're moving. If we can continue to move, let us continue to move. Advocate when the time is right.
Yeah, I've said it from the beginning, and I'll say it again. We still can continue to do business and do what we need to do. We just need an understanding of how this virus is transmitted, and follow the rules, and we can stay safe and stay open.
We've done it, and we'll keep doing it. And I will let you go and say thank you so much. We'll check in again, as we always do. And I think this has been a great conversation, because there is so much, we can all look to find vaccine information, and it's out there everywhere, but it really truly helps to talk and hear it on a local level. It really does have a lot of impact. So I appreciate it, Dr. DenBesten. Thank you so much for taking the time today.
Sure, and vaccine will be available. It is coming. I know everybody's anxious, but it will happen. People look at the immunizations. I got my vaccine 2.5 weeks ago. I'm due for my second one on Friday. I had absolutely no side effects, none. I didn't even feel the vaccine going in. The only side effects I had were an immense sense of gratitude and weight lifted off my shoulders, knowing that this is the beginning of the end.
And that's the perfect way to end it. Thank you very much.
Thank you.